we were seeing a tremendous number of patients with HIV. South LA is a hot spot for people with HIV. And so we began doing routine testing as part of our practice and found a significant percentage of patients that had HIV and had no idea that they had it. And realized that if we were able to do early intervention and primary care services for these patients, that it would have a profound impact on their health. So we decided it was critical that we move forward on this.
Now, when was this?
This is probably, well, we've always had a large number of HIV patients that have come through the clinic, but we often had to refer them out because we didn't have the in-home services. But the intensive testing began about a year and a half, 2 years ago, and we just saw the incredible demand for those services in our primary care center. We would tell people we were going to refer them out, and they didn't want to be referred out. They wanted to receive their HIV care at our clinic. So we thought it was really important to start developing that. I think we have a long history in South LA. We've been there for 46 years. We have deep roots in the communities that we serve. And I think it's very difficult for people to consider going outside of South LA to receive care, particularly to receive care that they've been confident in receiving at the community health center with their physicians. I think there's a lot of stigma and transportation issues in Los Angeles. South LA is a very isolated community. It's about 1.5 million people live in South LA, but it's extremely difficult as far as transportation and access to get out of South LA. It's one of the big problems, and so many people will live their whole lives and never leave South Los Angeles and never go to downtown LA, for example. It's just an extremely isolated place. So we thought, and people want the cultural sensitivity and the relationships, especially something as sensitive as HIV care. So what we were finding is that patients were increasingly talking about, I have HIV, but you're sending me out, and I don't want to go out. I want to get my services here.
Okay.